Well, a number of children's mental health issues skyrocketed during the pandemic. Fortunately, many have come down, but eating disorders in particular have remained at a record high. Some patients are being diagnosed at younger ages and in more serious condition. Joining us live in studio is Julia Cassidy. She's the Vice President of Clinical Nutrition Services and a registered dietitian with Alsana. So thank you so much for being here.
Absolutely. Thank you for having me.
And what a huge, important topic, right? Yes. Now, let's start with it. We talked about, during the pandemic, how the numbers for everything pretty much was high. Yes. But eating disorders, like how severe are they still? And put that into perspective for us.
Well, eating disorders are still on the rise, and it's been a couple of different things. So we have, with the pandemic, there's been isolation and then increased social media use. And the good thing is there's been an increase in mental health awareness, which has actually brought to light how severe the eating disorders are in our country.
Oh, wow. So because of that, there's more light that's shined on it? Is that what you're saying?
There's more focus, there's more area and attention on it.
Okay. And now, why haven't we seen it go back? Like with everything else going down and kind of leveling out, like what is it that, the pandemic's over with?
Right.
Why does it still continue? Like, what do you think those reasons are?
Honestly, first and foremost, I think it's diet culture. And then we are so inundated on social media. So I think social media would be the number 2 factor, especially with our adolescents. Their whole world is on the phone. Their whole world is in the social media, I want to say box, basically. And they are constantly seeing images of how to be better. They're constantly seeing images that are telling them they're not good enough. Not to mention all of these tips and tricks on how to have an eating disorder. And so it is going to really increase our numbers. And the thing with eating disorders, they are a mental health condition. And so the earlier we can get intervention, the earlier we can intervene and help these adolescents and adults, actually affects everybody, the better they'll off be if we can get them into treatment.
What you said on social media, there are tips and tricks for how to have an eating disorder?
Unfortunately, yes.
What?
Yes, there are.
Oh my gosh.
And part of that is just diet culture. Anything that has to do with diet culture, anytime we start restricting our food intake, anytime we are feeling guilt and shame around food, that is disordered eating. We should, as humans, should not be feeling guilty or shameful for eating a particular food, no matter what that food is. All foods have nutrients to offer our body. And so diet culture has really taken that intuition away from us.
And back when I was in high school, junior high school, there was no social media. We weren't constantly exposed to it multiple hours throughout the day. I mean, maybe a magazine or an ad on TV or a show. Like it has exponentially grown, right?
Yes. So when we were in school, right, so eating disorders are a mental health condition. That's anxiety, depression. Most people who have an eating disorder have a predisposition already. And so there's still different societal triggers. So it could have been comments, it could have been pressure from parents to do well in school, coaches saying the right or wrong thing, that could have triggered an eating disorder. Now with the social media, those triggers, those activators are in our faces all the time.
Now you help with treatment for this. Thank God there are people like you who are helping young people through this. Why is it though difficult? It's still difficult to get a lot of mental health help, right?
Yes. Depends on our access to care, especially in the minority populations. Eating disorders are not discriminatory, right? Eating disorders affect everybody. In our minority communities, they don't have the resources. They maybe not have the insurance that other people have. And so it is much harder. Also, in certain cultures, some of our I want to say the humans, some people are shamed for having an eating disorder, or it's part of their culture to eat larger quantities of food, whatever the case may be, right? And so our minority cultures they don't have the access to care that everyone else has. And so that is, I want to say, in conjunction with the rise of the eating disorders.
Okay, kind of to wrap this up here, what are some warning signs for parents to look out for? And then how can people move forward and get some help?
Warning signs is eating in isolation, restricting so they're not eating some of their favorite foods they used to like, increased irritability, increased depression, increased anxiety, and really just fear and feeling shameful around foods in general.
Okay.
Primary warning signs.
Wow.
Yes.
Well, thank you so much for all
welcome.
of your insight and everything.
Sure.
And thank you for the work that you do to help young people get out of this. So.
Absolutely.
All right. There's hope out there.
Yes, there is.
Julia, thank you so much from
you.
Alsana.
Yes,
right?
from Alsana.
Okay,
Yes.
there you go.
Yes.
Well, have a great day.